Now, as you know, we have been told for a long time that the vaccine is the cure to get us out of COVID jail, where, of course, depending on how paranoid your Premier is, you are sent to your room for a week if there's just one case.
Vaccines don't save lives, vaccinations do.
We do want to roll out the vaccine.
COVID-19 vaccine is key.
We want the vaccine to be rolled out.
The vaccination program is well underway.
How the vaccine rollout happens.
Preparation for the vaccine rollout.
Getting a vaccine.
The vaccine rollout.
Deployment of the vaccine.
Well, the good news is that the vaccine is now finally on Australian shores. The Prime Minister confirmed that today.
Mr Speaker, this is an historic day for Australia, as the Health Minister has just confirmed outside this place. I can confirm that Australia's first delivery of COVID-19 vaccines have arrived, Mr Speaker. The vaccines have touched down in Australia, Mr Speaker.
Now, this is a big, complicated effort because literally 25 million people at some point will need to get the jab. There are complications about how you move these vaccines around. A good decision made by the government was to be able to produce these vaccines, now that we've got the first batch, to be able to copy and paste those via laboratories all over the country, but mainly the CSL laboratories in Melbourne. Now, I wanted to explain this to you because there's a lot of people who just need to know, when am I going to have the chance to get the jab if I want to have the jab? Remember, of course, completely voluntary, but here's how it's going to roll. Here is the Health Minister explaining how and when you might be able to get the vaccine and get that key out of COVID lockdowns.
Stage 1A commences with our elderly and disability care residents and their carers and staff. Secondly, as part of 1A, we have our hotel quarantine and border force workers and others who are engaged in that international facing role, and our frontline health workers. Phase 1B will focus in particular on an age-based approach, the over 80s, the over 70s, the immunocompromised, Indigenous Australians over 55, and then certain critical workers. Phase 2 is the over 60s, the over 50s.
So where can you get the jab? There are going to be 30 to 50 sites around the country at the start, which are going to be hospital-based sites. When we get more information about whether they call you or you call them, I'll tell you about that as it rolls out. But this starts from Monday. So work out where you sit in this list, because by April, the expectation is that we could be having millions of people who have got the jab in just a couple of months. This is good news. So the first group of people, 1.4 million people, the people in aged care, the people who have, of course, been the bulk of the deaths, the bulk of the ICU cases. That process starts from day one, the people who care for them, as well as the people who guard our borders and the people who are in hospitals. That is the first round. The next round, which is going to take us from 1.4 million people up to 14 million people who, if you want it, can get the vaccine. Anyone over the age of 70, you'll be able to go to one of these 30 to 50 hospital sites around the country. Anyone who works in healthcare, younger people, particularly those with medical conditions like disabilities, anyone in the state-based emergency services, the Defence Force and meat processing workers as well, because for obvious reasons they are literally touching the food that we eat. The next group is going to be anyone over the age of 50 and anyone who has been declared an essential worker. Now, you know this process of the people who had to stay at home versus those who were able to go to work. The world of essential workers involves your teachers, all of these sorts of things. You'll all be there. Everyone else, well, it'll be, again, towards about June here, but the timelines might come a bit forward, a bit later. But all adults will be able to get it at any of those 30 to 50 sites, and any kids of whom it is recommended for. I just wanted to give you straight information about the vaccine that is totally voluntary, but a vaccine that is going to be rolled out to those who desperately need it first, because without it they become truly the ones at risk. Now also, the situation is that if we can do what we probably should have always done, which is fortify those that are most at risk of the disease, it starts to mean that the automatic panics and lockdowns because somebody in their 20s gets it means we don't start to lock down. Now, will there still be paranoid premiers? You bet. Will there be people who want to exploit your fears? You bet. But that's the rollout that's happening as we speak.